have a quorum based on the screen?
Yes, sir, we do.
Great, and we'll dispense with a roll call yet, however, and unless there are additions, deletions, or corrections to the minutes, we will move to accept them as presented. Are there any additions, deletions, corrections? Thank you. What Tom and I were just talking about is literally about 7 minutes ago, we received the University of Buffalo trustees received a note that Dr. Michael Kane has resigned effective August 31st. And they will be beginning a search. Yes. Anyway, let's go right to the board presentation. And I've asked Andy and Jim Turner to talk us through the campus transformation project. And I would remind everyone as we go through this that you might remember that we authorized the hospital to proceed with this project, which had a number of component parts. We're coming back to the board for your review of additional funding for that project, which really is in the context of two separate buckets. One has to do with the change of scope, which Andy and Jim will take us through. That is, we've added some things that as we peeled back the envelope, we needed to do, which is the largest part of this. And then ultimately, with regard to our window project, the delays in COVID have caused a number of delays, which has added costs to the project as well. So if you would, as they go through the detail and the drilling down of why we're asking for your approval, it is basically conceptually two things. One is the enlarging of the scope, and the second is the reality of COVID and the delays on windows. So with that, Andy, why don't you begin? And I know Jim is going to take us through the details. So,
thank you,
Professor Davis.
Thank you, Mr. Chair. I couldn't have teed it up better. I'm going to allow Jim to do the presentation, and then I'll present the resolution at the appropriate time. So Jim, if you go ahead and start.
Andy, why don't you start us, and
yeah, I can start it off.
We'll get going.
Yeah, so as we talk about the building envelope, there were certain major categories. Obviously, the atrium, the ECMC letter signage, and then the replacement of the windows. We are 64% complete. There are 1,540 windows that have already been installed, and we have purchased and stored 882. So there are a total of 2,422 windows that had to be replaced in the facility. Next slide. In terms of the roof, we're 45% complete. There were 13 major roof areas that we had to address. And most of those areas we thought we could do an overlay, but we had to do a complete tear off. And obviously we had a lot more saturation of water than anticipated. Next slide. The original timing of the project was slated to be completed December of 2020. We, if you remember, revised and had board approval to move that out to December 2021. And the new expected date is now June 22. As John alluded to, there were some changes in scope related to roof replacement, which was a large one. We also had some behavioral health ligature precautions that we had to do in probably about 60 rooms on campus, as well as changing the scope around inside work and site prep and anchoring and terminal cleanings and anchoring. A lot of that was fire issues that we had to clean up. And then I would say the largest issue was the project extension, including the COVID-19 pandemic delays. So in terms of
Andy, I'm back on, whatever you'd like me to do.
Okay, feel free to take over now. I'm over at the extending the project, so Jim, feel free to take over.
Okay, again, I apologize for the IT interruption. The reasons for the delay, the extension of the project was due to the issue about the patient care rooms. We didn't, as Andy mentioned, might have mentioned, in regards to the rooms being offline. So the one-year extension allowed us to extend the project, but conserve our loss of not only revenue, but also bed space. So that was the one-year extension. Below, when it talks about the COVID delays, New York State had a surge capacity requirement for us to be 25, 50, and 100% capacity. And we've been running that, and that is still in place now in regards to our oversight. And that's daily oversight of our capacity to help with the COVID issues around us. The average daily census in the hospital is about 480. And we are, again, our third surge of COVID is going on right now. We did focus on windows that did not affect patient care, but we are done with all those. And all we have left are the tower windows, which are all direct patient care right in the line. So, okay, next slide. Okay. This timeline of delay kind of gives you a scope of what happened within the past year. From February 27th, 2020, all the way to January 26th, there's been 5 delays, start-stops throughout this pandemic in regards to the project. And when you start-stop like that, not only do you lose efficiency, but you lose the whole project in regards to flow, process, rooms, all the dynamics of trying to get this up and going. So this slide kind of shows you some issues that we've been dealing with throughout this pandemic side this year. So next slide. So for us to complete the project, moving forward and complete the building envelope, we have the roof replacement that we talked about in regards to additional saturation that's going on, the behavioral health ligature issues that are going on, the time extension, and the inside work, that extension of timeline. So the total increase is $8.7 million for us to get to the end of this project. The windows and roof, just the overlook of this project, is $45 million. The additional 8.7 will raise this to a $53.7 million completion of this project. With this board request for authorization, we would be looking at taking this 8.7 from the bond reserve fund. And then this would then complete this project.
Jim, I could just add a little bit on that, if you could just go back one slide. So as we were looking at funding sources and what the most appropriate funding source would be, in a time when we can't really go to the bond markets to borrow more money for the project, we do currently have funds remaining from our 2017 bonding to complete the original authorized cost of the project. When we looked at it, it made the most sense for us to look at the funds that were available. This Ginnie Mae Bond Reserve Fund, that's the old name of it, but it really is the old funds that were invested originally into the Kaleida GVI bonds. That these funds are sitting available at this point in time, and we felt that utilizing 8.7 million of on-hand funds, still while leaving a little over 10 million of principal, was the most prudent available funding source.
Thanks, John. Anything further, Jim?
Next slide. It just opens to questions or concerns in regards to anything we discussed or any questions you have in regards to this project.
I just want to add, before I open the floor, the Building and Grounds Committee reviewed this earlier this afternoon, as did the Executive Committee last week. And I think it's fair to say that both the changes of scope and ultimately the issues related to keeping those rooms online, causing the delay, put us in a position where we didn't have much of many options. So Jim, thank you for managing the process, and Andy for keeping us on track. But anyway, floor is open. board, any questions for Andy or Jim?
John, Mike Hofford. I'd like to move it.
Well, first, any further questions before we do that? Okay, great, Mike, thank you. Mike has made the motion for approval. Is there a second?
Ron Bennett, second.
Thank you. Further discussion? All in favor, please signify by saying aye.
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 And those opposed? Thank you. Let the record, Jeffrey, show that the motion carried unanimously.
Yes, sir.
And once again, Jim, thank you for great work, and Andy, thank you as well. Let's go right to the resolutions, and the next one, Councilor Persico on contracts.
Good afternoon, everyone. I hope everyone's doing well. The Contracts Committee met on April 21st and reviewed the list of contracts, which I think everyone has in their packet. As you know, we have to review contracts in excess of 1 year. The committee discussed those contracts and recommended that we bring them to the board for approval. So I think there's probably a resolution to do so, and I would ask that the board approve those contracts.
Thank you, Jim. Motion's been made. Is there a second?
Second by Jim Lewicki.
Thank you, Jim. Any further questions, comments? All in favor of the motion, please signify by saying aye.
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 And the contrary? That motion carries as well. Thank you, everybody. Thank you, Jen. Karen Zemansky on the verified level 1 trauma center resolution.
Thank you. Good afternoon, everyone. This is a resolution for the Board of Directors of ECMC Corporation to support ECMC's verified level 1 trauma center to take all necessary steps to maintain the existing verification and designation as the level 1 trauma center.
Thank you, Karen. Is there a motion to approve Karen's motion?
Motion.
Mike Seaman, is there a second?
I'll second. Jen Persico.
Hi, Jen. Thank you. Further discussion? All in favor of that motion, please signify by saying aye.
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 And the contrary. Thanks, everybody. That motion carries as well. Dr. Cummings on the medical dental staff meeting minutes. Mike?
John, this is Brian Murray. I got a core text from Mike that he's en route 20 because he was doing a home visit that got prolonged. So he said he probably wouldn't be able to call in. So he's asked me to do the necessary. What you have available is the Credentials Committee minutes of April 1st, 2021, which were approved yesterday by the Medical Executive Committee. There were 11 resignations. And actually, one of the reasons we have that many is that the Jews were due. And often at that time, people—
Excuse me, Brian?
The Jews, the annual Jews were due. And sometimes people who are not active change their minds as to whether they want to pay those. There were 5 initial appointments, 43 reappointments. Neither resignations nor initial appointments were of great significance. We do want to mention that 15 allied health professional providers attended a CME-approved educational lecture on intubation medications. And this is in support of using a sedative propofol for intubation in the MICU and when they're called to emergencies on the floor. The lecture was very well received and has been approved as kind of basic privileging for those providers if they're going to provide those services, and we've revised the departmental privilege form accordingly. There's also one other thing I would like to mention from MedExec. MedExec also adopted a revised provider health and wellness policy. The revisions were needed in order to incorporate the role of the newly created Leadership Council. This is a body which reviews on a monthly basis all behavioral concerns involving providers and then reports to the Medical Executive Committee. So that, as a new committee, that had to be incorporated in the old policy, and those were really only minor changes. So I'll be happy to answer any questions and ask for the board's approval of the committee minutes.
Thank you, Dr. Murray. Yeah, that report was included in the packet. Dr. Murray has made the motion. Is there a second?
Oh, strictly speaking, I can't make the motion, John.
I know. I think I do that every meeting, Brian. My apologies.
Maybe someday.
Change the minutes, don't worry.
Is there someone
I'll
else
move
other
it.
than Brian?
Yes, I would be happy to do that. Jen Frisco.
Thank you, Jen. Is there a second other than Brian Murray? Gino, thank you. Any further discussion? If there are none, we'll go immediately to a vote. All in favor, please signify by saying aye.
Aye.
And opposed. So that motion carries as well. Thank you, Dr. Murray. Dr. Quattrochi.
Okay, good afternoon, everybody. Jeffrey, if you could pull my presentation up. All right, great. Thank you very much. Next slide. Okay, so obviously a COVID update. The team has done an unbelievable job of caring for the community. We've had over 1,100 COVID patients to date. We have about 50 patients in-house today. And that number has been holding there for quite some time. They've also done an unbelievable job of safely discharging patients either to home or other facilities. We unfortunately have 10 patients whom are vented, 0 patients under investigation. You can also see the number of negative tests that we provided. But we're also in the process of vaccine. That's okay. Also in the process of vaccination. And we've vaccinated over 30,000 individuals. So the team has done a really, really good job. We are doing walk-in clinics right now. So if anybody has a friend, relative, a child, a young adult, please get them in. We need to get people vaccinated, and we're putting on a full court press to do that. Next slide. Again, we want to make sure the board stays aware of the scores that we're constantly monitoring around hospital-acquired infections. The team has done a really, really good job of putting systems in place to make sure that we keep these down. It's been very challenging, obviously, during COVID and with a high volume that we've had to make sure that we hit all these measures. But again, the teams so far have been doing a great job. Next slide. Congratulations to Angela Vicanti. The Professional Nurses Association of Western New York is kind of the premier peer organization for nursing. And we're very proud that Angela Vicanti won the 2021 Nurse of Distinction for the entire community. So if you see Angela, please congratulate her. This is a huge honor in nursing. And normally there's an in-person event with a few hundred people at Salvatore's, but this year it'll be online. And as you can imagine, ECMC is usually the loudest table when we have this event. So we'll have to try to do that online this year, Karen. Make sure we make a lot of noise. Next slide. We also had 2 other nurses who were nominated, Nancy Rogers and Michelle Nance. Nancy for the Nurse of Distinction of Education and Michelle for Outstanding Staff Nurse. Next slide. We're also continuing to honor our nurses and our staff. As you know, about the Daisy Award, this is an award that obviously patients honor nurses, and also we have a new Nurse Hero Award, but we also have a new Tulip Award, and that award is for staff in our organization who do great things. And Rachel Hutzler won our first Tulip Award, so we could honor those who are not necessarily clinical nursing caregivers, but are the support staff that obviously are just as important in the patient's care. Next slide. And we're very excited also. We were winners in a UB Research Day, and I just wanted to highlight some of the first place and the second place winners in those categories. But again, another testament to the great quality care in nursing. Next slide. Patient experience. You can see that our scores, this is pretty consistent with what's going on statewide and nationally because of COVID. But our scores are down a little bit. We also have less elective patients, which typically raise those scores because their care is a little more linear, if you will, because they are expecting to come here and are out within a couple days. Where it's, obviously with other services, we have many consulting doctors, for example, on some patients who are very sick. The care is not necessarily when they're discharged and those types of things as expected. So we're continuing to institute things to make sure we raise these scores and raise awareness. We also have patients sometimes who send wonderful letters to us, a lot of them, that think that's their way of showing their appreciation, and we want them to fill out surveys, so we have an initiative around there to make sure that they fill those surveys out. Next slide. This is, we used to be called Patient Experience Week. We renamed it Human Experience Week to really focus on the human experience here at ECMC. Donna Brown has done a really nice job of having events all throughout the week, honoring the nurses, but also reminding everybody of how important what they do is to the patients here at ECMC. Next slide. We actually have been doing some wall murals. Karen Zemansky has led the way on making sure that we brighten up some of the areas of the hospital, and I just wanted to highlight this area in CPAP. It really is an unbelievable change from the kind of white walls as you kind of walk into our psychiatric emergency room, and we actually have people sometimes just kind of stop and are amazed by it. So Karen, thank you for that initiative, and I know you've been doing that in some other areas of the hospital, and it's been very, very successful. Karen, do you have any other comments on that? I know we had some staff involved.
Yes, some of the walls are done by the nurses that are artists or other staff members that are. And this one in CPAP, it was done by individuals in the community that had close ties to CPAP, either with their families or loved ones or visitors. And they did this wall, which is really amazing because they're artists that volunteered their time. So we were quite excited.
Thank you, Karen. Next slide. Culture. Installed. There we go. Thank you to the women board members who did a webinar for us on women empowerment for diversity, equity, and inclusion, and it was very, very well received. And I just want to thank all of you for your contribution, your continued volunteering of your time to make ECMC a better place. Thank you. We have a new HR self-service area. We have, obviously are trying to become more electronic, and many of the HR functions and payroll functions that we have here at ECMC. Joe and his team did an unbelievable job creating a very nice area for employees to come in and really do more of a self-service model, which obviously allows us to not have as many people doing those functions, but kind of starts to get people used to a more electronic HR and payroll function. So, kudos to Joe and the team because it's been very, very well received. Next slide. We also had a COVID vaccination virtual town hall. I believe this was the actual day where J&J was put on pause. So they had a lot of questions, but it was really, I think, after this town hall, I know we had a fair amount of employees get vaccinated. So this group did a really nice job answering questions and talking about the importance of vaccination for our entire hospital. We are in the middle of Patient Experience Week, sending out a employee appreciation gift that'll be coming to our employees this week, courtesy of the foundation. Many, obviously, donations were given to support our caregivers. So we usually do these things in person, and we can't celebrate like that these days. So we decided to actually mail them to their homes. So the employees will be receiving those gifts this week. Just an appreciation.
Those sunglasses have Andy Davis written all over them.
Oh, absolutely. Yeah, we made sure he modeled them before we bought them. So they look good. Next slide. Just remember, Andy, when you're cool, the sun shines on you 24 hours a day. All right. We obviously have a lot of celebrations for the next few months, April and May. I'm not going to read all these, obviously, but we have many celebrations, and this month coming up in May, most notably, actually is Behavioral Health and Nurses Week coming up. But there's many other areas that we're recognizing employees in. Next slide. We have put our surge plan in full motion. As of late, we've been extremely busy. And normally, as you know, high 400 census is very busy for us. We've been over 500 many days with patients waiting in the emergency room. It's a combination, obviously, of our new ER and some of the efforts we have done to educate the community about our services. But also, I think St. Joe's closing had an effect because we did have an increase in some of those zip codes coming to ECMC. So the team's done an unbelievable job of making sure that we take care of the additional COVID patients in addition to all the additional other patients that we received. And it hasn't been easy, but the team's done a really good job of making sure that patients move safely through the system. I just want to thank everyone. New York State budget's complete, and we I think fared pretty well during the New York State budget. We did not really have any cuts go through, new cuts anyway, that went through. So we're kind of holding status quo, and obviously our belief is that, especially around Medicaid, we should be increasing reimbursement, but we'll be fighting those battles here in future years. Staffing legislation, there's a new legislation that hasn't been totally finalized, but basically will require a committee to be formed. And this is kind of in lieu of some of the safe staffing ratio legislation that was being proposed, but a committee that will be put in place of employees and then also management to decide on staffing plans for the entire organization. We have this in nursing right now through our nursing last nurses contract, but this will include all members of the ECMC family, not just nursing. So this will probably get instituted towards the end of this year. The Department of Health will, after legislation passes, will have to put in requirements around this. And then finally, Tony, do you want to speak a little bit about Great Lakes Health reorganization?
Sure. For those of you who recall, this organization was first formed in 2008 and has gone through a couple of iterations of its existence. Most recently, prior to the most recent reorganization, we had approximately 17 members, and we found it difficult to keep those positions filled, especially the community positions. And so the board voted to downsize the size of the board to 9, essentially 2 each from UB, Kaleida, and ECMC, and then each of those constituent entities, which, as you may recall, those are the founding constituencies for Great Lakes Health. Each of those designate a third member, which would be a community representative. On behalf of ECMC, we designated Robert Joya, who is, for those who recall, the longest serving member on Great Lakes Health and also the chair of the board. Kaleida has designated Jody LeMayo, and the university has not yet designated who they propose to be as that 9th member, though we expect them to do that shortly. The organization has refocused its efforts away from its original list of priorities, which frankly it accomplished, and is now more focused on the 7 initiatives that Tom and others were helpful in getting included in the ECMC Act amendment back in 2016, which relate predominantly to joint and collaborative efforts by ECMC and Kaleida on a clinical quality and marketing and purchasing line. Good enough?
Okay, thank you. All right, any other questions? So the next slide is obviously our key statistics. We're starting to see business come back. You can see where our discharges overall are, obviously compared to previous year. Obviously we started to see as things closed down, less volume last year, but we're very happy to see the obviously increased in outpatient surgeries. You can see down below as well as observation cases going down a little bit and emergency room visits going up, and admissions through the ED going up. So John's going to talk about March hitting budget and actually being a little bit better than budget, not to steal his thunder. So we're beginning to see operationally positive results. And again, the team has done an unbelievable job of managing expenses through all of this to make sure that, again, we start to hit budget. So with that, I'll turn it over to John, unless there's any other questions.
Tom, just before John goes through the financials, 2 comments for our board. Karen has done, and the nurses have done a great job in those interior spaces. So Karen, thank you. It is really turning the corner on some spaces that were sort of dull, but I've been through a bunch of them, and they really are tremendous. So thank you, and thank you for the nurses that did that. I didn't realize, in addition to their nursing talent, that we had artists amongst us.
Thank you. I will let them know.
Please do, and maybe you can connect with Peter on our art project and move that forward as quickly as you got that done. But they really are spectacular. And with regard to the HR room, I would invite the board to stop by there. It's not far from where the foundation office is. Thank you to Sue Gonzalez and Stacy for helping Joe and his team. That space is really tremendous. And members of the board, if you are in the building, you might want to take a walk through there. But it really puts us into the 2020. So thank you. Great job, everybody.
Thanks, John.
John,
Okay,
please, on the financials.
excellent. So as Tom mentioned, we've been very busy. This extends back into March. Excuse me, you can see it on this slide. Tom talked a little bit about inpatient cases starting to return. That's true. However, they've been slower to return in inpatient surgery. So when you look down the sheet, you can see we're down about 15% in inpatient. The bright side is, as Tom mentioned, we were over our plan by about 28% on outpatient procedures. That really is signifying and solidifying somewhat of a return from those procedures that may not have occurred in January because of the restrictions, but also a little bit of that shift that we continue to see from inpatient to outpatient, more specifically in orthopedics. Next slide. So the good news is that that volume, along with our actually some increased terrace view days and admissions during the month, as COVID positive cases became negative over the course of time in terrace view, we were able to take some additional residents in. You can see on the top line here that we're green as it relates to the month's bottom line. So the overall net loss for the month from operations is about 1.2 million. We had budgeted about 1.4 million. So we were better than planned. And it's good to look at this and really think back over the last year. This is the first time really in the last year that our net operating income beat our operating plan without any aid from the federal government. So good news on that front for the month. A couple other operating statistics that I just wanted to mention on this dashboard that we look at now every month. First is the average length of stay. While it's still red, it's still over our operating plan at 7 days. It is significantly down from the last couple of months. And you can see as it relates to year to date, well below our year to date days. That's a testament to not only Dr. Murray and Karen and Andy and their teams working on a daily basis, really doing the blocking and tackling, but also the many physicians and the teams in the emergency room, because that volume has significantly increased and continuing to move patients through our hospital as efficiently and as effectively as possible while still providing the best quality care. The other item I just wanted to mention, 2 things actually, FTEs. As we've talked about before, we continue to manage FTEs through vacancies. When you look at this document, this at 3,476 for the month of March, It's actually down from where we were last month and down from prior months as well. We're not quite at our operating plan. The operating plan, if you may recall, was 3,462. The reason really for that, if it were not for about 20 to 21 COVID-related paid leave FTEs, we'd be pretty close and actually beating our operating target for FTEs. So kudos to the team for managing that while still making sure we have enough staff at the bedside. On the days cash on hand, I did include now the budget that we had originally adopted for year end. So that's 70 days is just a placeholder to kind of watch it and monitor. We're at 112 days, so we're still operating at well above that. But we will start to, as we've talked about, continue to see that start to decrement over the course of the year as a result of several paybacks we'll have to make that I'll talk about in a few moments. So on the next slide, just as a summary, again, we were at about $1.2 million in operating loss compared to $1.4 million. Really strong on the revenue side. With that volume and with that revenue came volume-related expense. So we were able to still manage the discretionary costs, but we still did have COVID costs in lab and supplies, but also more so when you look at this, the expenses related to staffing and supplies that were required to really take care of the volume that we saw. So on the next slide, when you look at it and it really rolls forward the whole first quarter, we're at about 13.7 million compared to a $6.3 million loss. So January and February are still really the story when you think about this first quarter and the restrictions that were placed on us in December that really fed into the month of January, and then again really had a little bit of a lasting effect into February. So that still really is the story. But March was a really solid month as it relates to starting to see some signs of recovery. Next slide. Okay, so just to continue to track our COVID impacts, the majority of what was added here this month is related to expense, staffing, supplies, as I just mentioned. And so that brings our total for the quarter to about 12.1 million, brings our total since last year, since the pandemic began, to about 109 million. These are exclusive of the pension related costs that I know we talked about for 2020. However, those pension costs were really indirectly COVID related. More to come on that as we start to learn about what the New York State pension costs will be for 2021. One additional item that is now somewhat familiar to you from the earlier presentation, I will start to include this as a cost of COVID related to the potential and proposed future related project delay costs, really related to COVID. And that's primarily on the building envelope and windows project. Next slide. Okay, just a couple of updates. I won't go through all of these, but no real new news on the $6 billion that's undistributed from the original CARES Act funding. That is still in existence. And as organizations who have received funds are paying funds back because they can't use them, or other organizations that were part of the push through of these funds through the CARES Act are starting to bring their monies back. There could be more dollars, but right now they have not yet decided how those will be distributed and how the applications will go or to whom at this point. So more to come on that as we learn more. As I said, the days cash on hand is 112. However, we did start paying back our $37 million Medicare loan, which we took out as part of the CARES Act relief last year. That began on April 12th and will continue on a weekly basis over the next year to year and a half, depending upon how much they take out each time. But roughly, they'll be withholding about 25% of our Medicare payment each week. until that's fully paid. So that will be certainly one area where we'll start to see the cash decline. And of course, the authorized 8.7 million that that the board just authorized is also in our cash calculation. So that will begin to be spent as we continue that project. And I think Tom took care of highlighting the 2021-2022 New York State budget. As he said, really the executive proposed budget, all of the significant proposed cuts for Medicaid were rejected. And there are things that were advocated for that did not make it into the budget that there's still significant advocacy on. One item in particular is really designed around forcing further accountability onto the insurance plans and the payers. And that's some advocacy around forcing the payers to pay first and pursue any potential denials after, so that we who have provided the service at a cost are reimbursed for our costs and then work with the payer afterwards. Today, it's a bit, it's really done in reverse. And so more advocacy there on that. And I think that's going to be one of their top priorities this upcoming year, to try to work with that. I'll stop there, John, if there are any further questions.
Questions for John? Thank you very much, John. We'll go to committee reports. With regard to the executive committee, I would only thank everybody for responding to both the board skills matrix as well as the CEO review, and we'll be that both of those in our subsequent meetings. Finance, Mike Seaman. Mike not with us? Okay, building and grounds, Ron Bennett, and I know Jen chaired the meeting this afternoon. Jen, anything further that we want to talk with the board about?
No, I think Jim and his team, as usual, have done a great job with a very complicated process to begin with, further complicated by the pandemic. And so, as you heard in the earlier report, we are on track to have the envelope projects done by 2022, which I think is a testament to the great work they do. And they've done a lot of great upgrades around the hospital, which I'm sure all the members will see when you're in the hospital. Otherwise, I think that's it.
Great, and thank you for stepping in this afternoon. On contracts, I think we went through that, but anything further? Jen, anything further on contracts?
Oh, I'm sorry. No, nothing further. Sorry, I lost my ability to hear and click at the same time. I apologize.
Thank you. Sharon Hanson, governance.
Okay, good afternoon, everyone. We had a governance meeting in March, and there were several items that we discussed at that time, and I'll call on Tony to help me through this in a bit. We talked about several things, and that you're going to have an opportunity to hear Tony's report on that on my behalf. Affirmative action. Some of these things that we talked about need the full board approval, and Tony will certainly let you know which ones of those apply. So without any further comment from me at this point, I'll turn it over to Tony.
I think
Thank you, Sharon.
we covered most of the governance issues at our last board meeting, actually. After the governance meeting, we had several of our policies that needed to be reviewed, which the board voted on at the end of March.
Great, thank you, Tony. The QI committee, Ron Chapin. Do I see him on our? I do not. Okay, QI, Mike Hoffert.
Yes, John. We had a presentation on chemical dependency from Dr. Azid Farid. And we had another presentation on laboratory medicine by Dr. Paul Hosking. My props to the lab for all their hard work during the pandemic. And also, we had another presentation on patient experience and equity by Donna Brown. Donna, I don't know if you'd like to comment on that. I did virtually attend the presentation by the 4 women board members, and it was absolutely tremendous. And I don't know if you'd like to comment on that as well, Donna.
Oh, sorry, couldn't get off mute. So for the patient experience presentation, thank you, Mike, and we're getting into the full swing of the human experience. Actually, it's human experience and equity as we move forward. So this month, particularly this week, we're in the throes of a number of different ongoing events that I'll report out, or that will be reported out for next month, just to really get the team refocused, re-energized, and kind of revitalized back into the normal stream of what this new existence is going to look like as we move forward. So that was pretty much what we captured in our report last month with the QI report. And unfortunately, I was not able to attend the panel discussion. And I don't know if Jen or Sharon or Darby wanted to report out on that, but I'll leave that to you, Mr. Dandies.
Thank you, Donna. Thank you, Mike. And once again, as Tom suggested, that session was tremendous. So Jen and Darby and Sharon and Katie, thank you again for that. On our agenda is a move to executive session. So I would ask for a motion to move into executive session. Is there a motion, please?
So moved.
I'll
Motion
second,
been
Jen
made
Persico.
and seconded. All in favor?
Aye.
Aye.
We're back online?
Yep.
Okay, great. Thank you both. Unless there is any new and or old business for the good of the order, is there any? Okay, well, thank you all very much for joining us this afternoon. We invite you once again to see the new HR area and Karen Zemansky and her associates art. That we are adjourned, everyone. Please stay safe and stay well, and we'll see you next month. We are adjourned. Thank you.